I'm the CEO of Ciena Healthcare Management, based in Southfield, Michigan. We're the largest nursing home, skilled nursing care, short-term rehab provider in the state, with 33 communities from Monroe all the way to Escanaba. So we're truly a Michigan company, Michigan-based company, and as a matter of fact, now we've gone to another state as well. We have some facilities in Connecticut as well, which has basically added some more jobs here in Southfield, Michigan. Let me tell you a little bit about this facility. This is going to be one of our newest facilities. We've built 4 new buildings in the past about 3 years. Ciena is really in the forefront of what I call a change in long-term care / short-term care rehab. Most of the nursing homes, as you know, were built back in the early 60s, early 70s across the country. And it's an old stock. Most of them were built, pretty much all of them were built as institutions. So they have a look and feel of an institution. Many of them have what you call is like 3 or 4 bedroom wards, or even the semi-private or small rooms with 2 beds in them. And it was basically a medical model. What we are really part of it is this change that's taking about throughout the country, but we're really in the forefront of changing the perception of nursing homes, taking it from an institutional model, from a medical model, to really make it more like a home-like environment with all the amenities of what you would find in a state-of-the-art skilled assisted living, those kind of amenities, with a big emphasis on short-term rehab. As you know, many of our relatively younger residents, in their 60s and early 70s, are there for short-term rehab. And then you have the truly elderly population of people in their 90s. We have, I think, a number of folks now in our communities, and every time I get an opportunity I go there, who are celebrating their 100th birthday. Once this is built, this will be really, there is nothing like it in Oakland County, period. Particularly considering that it's a Medicare and a Medicaid facility, which means nobody gets denied as far as admissions go. Most of the new buildings, if they're built, are geared toward private pay, and forget about Medicaid and so forth. So we're really proud. We take a lot of pride in serving the community. We don't pick and choose when it comes to that. Other than that, it'll have the other rooms are semi-private, but they're pretty much like suites. The other amenities that will be included are the salon, the dining areas, outside courtyards, library, so, a wonderful, huge rehab area with a big emphasis on rehabilitation, short-term rehab. So it'll serve not only the long-term care residents, but the short-term care residents as well. So that's what I wanted to share with you. Now, what makes this project unique, other than our other new homes that we have done, this is a replacement, as you know, many of you know, for the medical county facility at the Oakland County campus. 2.5 years ago, once we heard that the Oakland County was looking for some alternatives, that there were some challenges, operational challenges, along with some losing some money, and for some reason I think Brooks didn't like that. So particularly I think it was a couple of $1 million a year that the county taxpayers had to subsidize this facility. So I think when the county started looking, and that let's look at all the alternatives, we submitted a proposal that was basically a win-win situation. And the county commissioners, under his board leadership, took the decision that yes, we're going to turn over the management to people who know what to do in long-term care, skilled nursing, and we really made it truly a win-win situation for the taxpayers, for the county, for us, and most importantly, the residents of this county, the ones who are at Golden Oaks right now. I think there are about 90 residents right there, who are going to move into this brand new, beautiful new house, basically, moving from a 40-year-old building. So that really is very exciting to me, that they're just gonna, they're gonna be very delighted once they get here. At that time, the county facility, like I said, had its challenges. I think this is a wonderful example of public and private partnership where we were able to either save or create about 120 new jobs. So in addition to that, look at all the construction jobs that have been created. So this is a replacement building for the old building. So everybody's a winner. Like I said, particularly the residents of this county, when they need services, they'll be going to a facility that is state-of-the-art, nothing compares. So I'm really, really delighted.
1, 2, 3.